blood sugar levels, blood glucose, we hear those terms frequently, but what do they really mean for our health? Poorly controlled blood sugar levels can take years off of your life, but a lot of people don't even realize they're at risk. So today we're breaking it all down with Dr. Olu Jegede, Senior Vice President and Chief Health Equity and Community Impact Officer with Cone Health. So we're talking about how you can also get a free blood sugar screening coming up. Let's first talk about what are the dangers of any kind of uncontrolled sugar levels when it comes to your long-term health.
Good evening, and thank you for having me, Tanya. So diabetes is a very serious disease, and uncontrolled blood sugar has a lot of complications. So controlling blood sugar, for example, is essential for overall health and outcome, and also preventing serious complications. So for example, the complications that you may have when you have diabetes or uncontrolled blood sugar includes renal disease. I mean, kidney failure is one of them, or kidney disease before it gets to end-stage renal disease and being on dialysis. Can have cardiovascular disease from uncontrolled blood sugar. And those cardiovascular disease varies in different forms. So for example, if you have peripheral arterial disease in the legs, those are the reasons why some people go on to have amputation, which will really take life off of your age if you have that complications. And of course, we have other things like eye disease, blurry vision, you may have stroke and even death. So we usually advise all our patients when I see them in the clinic, we have to be serious about controlling blood sugar. Diabetes is not a death sentence. It is controllable. You just have to do the right thing to get your blood sugar under control.
All right, let's talk about who then is at most risk for high blood sugar or diabetes.
Yeah, so several factors can increase the risk of having high blood sugar, particularly individuals who have diabetes or what we call metabolic disorders. Those metabolic disorders are really diabetes and where you have high weight, if your weight is on the high side, and cholesterol. So for these people, they are at risk of developing high blood sugar. And those that have insulin resistance, like obesity, or individuals who have poor lifestyle, like just unhealthy habits, sitting down most of the time, not eating well or they're eating right and not having exercise. So those can have at risk of high blood sugar. Also, some people, because of some congenital disease like endocrine, like thyroid, disease, they can also develop high blood sugar. Some patients who are on steroid, yeah, if you are COPD or maybe for some other reasons you are on corticosteroids as part of your medication, you can also develop blood sugar and it can be very difficult to control. This is the reason you have to work with your provider or your doctor to make sure that you explain all these things and have a shared decision making on how to control your blood sugar because it is critical that blood sugar is controlled so you don't have those complications that we just discussed.
Okay, so controlling your blood sugar, you can only control it if you know what your blood sugar levels are. And so how does someone know what their blood sugar level is?
So interestingly, 1 in 3 Americans actually have what we call pre-diabetes. So pre-diabetes, your blood sugar is high, but it's not high enough to be diagnosed as diabetes. And if you don't know that you have pre-diabetes, you may quickly convert to diabetes. So that's why we say everyone needs to be screened, especially when you are 45 years and older. American Diabetes Association recommend that you get tested at least once for baseline, maybe every 3 years as needed. But if you have pre-diabetes, then you have to be tested maybe every 6 months to 1 year to make sure it's not progressing and actually reversing it to normal level.
Okay,
And
so
then if you
I think, oh, go ahead. I think a lot of people think, oh no, I have to get screened, which means I got to go to the doctor and I got to do all this stuff. But actually, Cone Health is having an event this Saturday that includes a free screening.
Absolutely. So with Cone Health, we started the Building a Better You event in 2023. We had it in Greensboro 2024. This time we're having it at Alamance County in partnership with Ebenezer United Church of Christ. And that is where we're going to have it on Saturday, April 12th from 11 a.m. to 3 p.m. Everyone is invited. Everyone is welcome to come. You're going to get screened for blood sugar, blood pressure, cholesterol. We're also going to screen which is not common in other screening events. We're going to screen for what we call the social drivers of health, including transportation, including food insecurity, and other things like the social drivers. So for those ones, we partner with our community-based organizations. They're going to be on this court with us on Saturday, and we provide all these services. So if you don't have food, we have people who can connect you with food. We actually have people who can connect you to job search, and some people have found job in some of our events in the past. You can have housing, if you are experiencing maybe housing issues, we will have people there to help you, through all that,
Okay,
So
so
yeah,
taking care of the whole person, health wise and every way around. Okay,
absolutely.
we're going to take a
Yes.
quick break. We'll be right back.